a couple polar ends, we're going to have Simon Bartold, who, of course, has done a lot of stuff with shoe design. And then we're going to have also Golden Harper, who designed the Ultra shoes, which is a zero drop shoe. And, I get a lot of interesting things from both these guys. I know Simon of late has been talking about the emphasis on looking at the sagittal plane as well, because of the importance of the torques in the sagittal plane versus not having quite the same torques when we examine from the back or the front in the frontal plane. Golden, of course, is always throwing good exercises out, especially for runners. One of the things I picked up lately was balancing on your forefoot. So it's easy enough to balance on one foot, flat-footed, sometimes closing your eyes or even challenging with catching a ball. But when you start to get on your forefoot, you're really engaging the glute medius and those ankle muscles that go cross above the ankle. So that's something that I just started doing with my patients when they are up for more of a challenge than, let's say, somebody that might be more sedentary. Have there been any things, I guess, that you have come across that you could share with as little game changers? I've got the football field in the background. We're teeing off, as a sort of just a representation of what we're going to be doing, teeing off for our summit symbolically. But is there anything that you have found that's been sort of a game changer in terms of specific exercises? I know you use braces. Anything else that you might want to share?
Yeah, I mean, I always speak to patients about strengthening in the posterior chain. One of the exercises that I give out for that is just a single limb hip hinge, either with or without a weight. So sometimes the weight can actually help kind of get that patient into that single leg hinge. But I try and get them to work barefoot actually in this exercise. And if they want to add a small weight, that will allow them to hinge with more ease. So that's something that personally I practice myself every day as well.
Can you describe it? Can you describe the exercise itself?
Yeah. So basically, the patient will just be stood in front of you. I'll get them to go into single limb support if they're able to. And then I might ask them to hold a small weight, and I might ask them then to hitch forwards, but hinging at the hip, and they're kind of dropping the weight parallel down towards the ground beneath them. And what we're looking for is for them to engage the hamstring. So they're going to feel that pull in the hamstring. So what we don't want to see is a straight leg. We want to see a slight knee bend. And when they then deviate into that forward lean position, we don't want to see that hip is altering its position either. And that's quite difficult. And I think that's one of the key exercises that I look at just in single limb support.